Did you know?
Hi, and welcome to this week's episode of Did You Knows? This is an episode that I've actually been looking forward to for a really long time, and one of the reasons I started this whole series. Today we are going to be talking about how neck pain and headaches can be related to nasal obstruction. Historically, this has been called a cervicogenic headache, but this term's been somewhat confusing because many people think of a cervicogenic headache with referring only to things like arthritis of the neck or nerve impingement coming from your spine. When I'm talking about a cervicogenic or neck headache that's related to your nose, what I'm referring to is the accommodations that we make when we have nasal congestion or nasal obstruction. Referring back to our earlier videos of nasal anatomy, if you recall, within our nose we have the structures called our septum and turbinates. Those are structures that will impact the ability for us to breathe through our nose. Based on gravity, we can actually change how much congestion or swelling is present within a turbinate. If we hold our head to the side, we can actually make the top turbinate start to drain into the bottom turbinate. This is one mechanism that we can use to try to get our nose to open up, and is very common for someone to do subconsciously when they have a deviated septum. So for example, if your septum is deviated and you want to be able to breathe through that side of your nose, simply turning your head to the side can help that turbinate drain and will let you start to breathe again. What's really crazy is that we then do this subconsciously. We don't even realize we're doing it. And so then we walk around, and of course I'm exaggerating, with our head off to the side, resulting in all of these muscles coming down into our neck, and into our shoulder, and into our back. So often I'll see patients with nasal obstruction complaining of one-sided symptoms that are the primary problem. And what's amazing is that if we can actually address these problems, we can see neck, shoulder, back, and head pain go away, sometimes almost instantly. Now there are other habits or other orthopedic issues that may need to be overcome, and so not everyone will see instant relief when we fix their nasal obstruction. However, often we will struggle to really see long-lasting relief until we do address that source of nasal obstruction. Thank you for joining me this week on Did You Knows? Give us a call or send us an email if you'd like to schedule an appointment so we can figure out what's going on with your neck pain or your headaches. See you next week.
Did you know?